Okay. Hi, I'm Dr. Donna Krepak. I've been a pediatrician for about 28 years following residency and have been in the Temecula area since 1998. I'm a DO instead of an MD, and some people might not know what an osteopath is. A DO is Doctor of Osteopathy, but basically we have the same education that an MD does, but we also have classes related to manipulation, because the feeling of osteopathy is that some nerves that supply organs also go through the muscles in the back and other parts of the body, that if you manipulate those areas that it's supposed to help to treat whatever medical problems the person has. But in my profession in pediatrics, we don't really use that at all. So most people don't even know that I'm a DO as opposed to an MD. So.
Okay, and so that's great. The first question is, did you know in high school that you wanted to be a pediatrician?
Not a pediatrician. I knew I wanted to be a doctor since I was like in 7th grade, because we got to do some dissecting of different animals like fish and a worm and a frog, I remember. And I just thought it was really cool to open stuff up and see how it works. And so I decided at that point that I wanted to be a doctor. And a lot of people say, well, why didn't you want to be a surgeon then? It's like, well, even though I like to open stuff up and look inside, once I start to get into the program and do my clinical training, my first rotation was pediatrics, and I really liked interacting with the kids and taking care of them and trying to make them feel better. So that's why I decided to be a pediatrician instead of a surgeon.
Okay. So what college did you attend for your undergraduate degree?
I went to Drake University in Des Moines, Iowa, and did, it was a 4-year program, but I finished in like 3.5 years.
Okay, and so where did you go to medical school?
I went to the osteopathic school in Chicago. They changed their name now and they moved the location, so I can't remember what the new name is, but it's the only osteopathic school in Illinois. But
Okay.
It was called the Chicago College of Osteopathic Medicine.
So what did you major in?
In college, I majored in biology, and I was pre-med.
Okay. From the time you graduated high school to the time it took you to complete your residency, how many years was that?
Normally it's like 4 years of college, then 4 years of medical school, then a year of internship, and 3 years of residency. So,
Okay.
because I finished my residency in 1984, and I was born in 1954, so it gives you an idea of how many years.
Mm-hmm. So was the MCAT hard?
I remember I didn't do very well in the test. I never did well in standardized testing, though. So the thing is, Illinois has a lot of medical schools, so I had applied to all of them, and I was denied entry. And the osteopathic school, by the time I found out that there was such a thing, because I didn't know anything about osteopathy, and my advisor in college said that I should apply to osteopathic schools as well, because he thought I might have a better chance of getting in there. And by the time I went for my interview, they had already filled the whole class, so I was put on the waiting list. But it basically was because of my interview that I was told that I was going to be on the waiting list. So, even though, they tell you have to get straight A's in college and you have to have high MCAT scores, a lot of it depends on if you're able to get into an interview to make yourself show something about you that's different, that would set you apart from other people that might all have the same grades and all that type of thing.
Mm-hmm.
So.
Okay. So were the work hours in residency really as long and as ungodly as the stereotype portrays it to be?
Yeah, definitely. When you're a resident, you have to be on call. At that time, we were on call usually every third to every fourth night, and you have to stay in the hospital, so if you're able to sleep, there's a call room for people, but you have to be available to take care of patients at any time of the day or night, and, depending upon how many admissions you might have, because you have to admit people to the floor that were brought in from the emergency room. And the program that I was in was through the Phoenix Hospitals Affiliated Program, and there we were covering 4 different facilities between all of the residents, so the call schedule was actually sometimes every 2 days even. But we had outpatient clinics we had to work at till late in the evening at times. So even though we weren't on call, sometimes we'd be there till 8 or 9 o'clock at night, and then you'd have to be back the next day at like 7 or 8 in the morning.
Yeah. So in totality, how did you manage the financial burdens of medical school?
Well, I was lucky because my parents have worked real hard. They're considered, middle class, hardworking people, and they had started saving money since, I was born for college and that. And, I went to college back in 1972, so college was a lot cheaper than it is now. I don't even remember how much it is, but I don't, I think maybe a year of your tuition would pay for 4 years of ours or something. But
wow.
I did have student loans for the osteopathic school to help pay for books and living expenses and that, because even though I'm from the Chicago area and I was going to osteopathic school in Chicago, it was down in the south side of Chicago, actually where Barack Obama lived, in Hyde Park. And I wanted to live there so I didn't have to commute all the time, so it helped to defray some of those. But most people, when they leave school, they have a lot more loans than I did. I think mine were like $15,000, and I think most people, you're lucky if you could get away with $15,000 for 1 year. So.
Yeah. So if you don't mind me asking, what is the annual salary of a pediatrician in general?
Well, it really varies in the country. Typically in the West and the East, probably pediatricians get paid a little higher, but the average salary of a pediatrician is probably the lowest of all the specialties, even family practice. So I'd say it's probably around maybe $115,000 to $125,000, depending what part of the country you live in. And a lot of it depends on if you're employed or self-employed. More and more doctors aren't going into their own private practice. They're joining big groups where, you get salaried and you have benefits and all that compared to what I'm doing in private practice. So you don't find, small groups of doctors anymore. Usually it's easier for doctors to join other groups so that way they're not taking call as often, because even when you're in private practice and, or working for a group, you usually have to take call unless they have a hospitalist or other people. So, the more people you share a call with that help cover your practice, if you take vacation, the easier it might be for you to be able to go away on a vacation.
Okay. How many patients do you currently have?
I don't really have any way of knowing. On the average, most pediatricians will see between 25 and like 45 patients a day, which normally for me, like right now, because the economy, business is a lot slower than it used to be. On a good day in the winter, I used to see close to 25 a day. It's not that much now, but most groups that are busy that had a bigger practice to start with are going to see a large number of patients a day, where people are basically, you're going in and out of rooms a lot quicker than what I typically do. So people might feel like they're maybe a little bit more rushed and can't spend as much time with patients as they would like.
Yeah. What were the most memorable cases you have had, if you can talk about them?
Well, the first one that kind of got me interested in pediatrics when I was a resident when I was in medical school was a little boy that had an infection in the bone in his leg. And back then, kids were in the hospital for 6 weeks getting IV antibiotics the whole time, where nowadays there's a lot more outpatient care that can be done, so that type of patient, would have some type of a line put in so that he could get antibiotics either by going to the doctor's office or having a home health nurse do it. But this boy, because it was back in, like 1978 actually, because I finished training in 80. He was there for 6 weeks, and I would go visit him, and when I didn't have anything to do, and play with him and try to interact with him and stuff. So he was real special to me. And then it's not like any particular patient so much, but when I was in residency, especially working in the pediatric intensive care unit, we had a lot of cardiac surgeries and infections, kids with meningitis and serious infections that used to get transported from like the Indian reservations in northern Arizona, who died. And nowadays with vaccinations, a lot of those patients would survive that, weren't able to back then, because back then there weren't vaccinations for those types of diseases that there are now.
So one of our club members wanted me to ask, why do pediatricians in general ask their patients personal questions?
It's not that we're trying to be nosy or that kind of thing. It's more, trying to treat the whole person, because, if I get the idea from the ways of parents talking that maybe they're separated from their husband or they're getting a divorce, it affects the whole family. And, if a child, even a younger child, can be depressed and be sad or have mood changes or personality differences, even in a toddler, because they sense things, So, and some people, if they're sad, they might start to have headaches or stomach aches, and it's not necessarily a medical thing, but, they're affected by things going on around them. So it's just a way of making sure we're not missing something and making sure we treat the whole patient and not just like the disease, So.
Okay. So what are the most irritating aspects of being a pediatrician?
Really, because I'm in private practice, the only thing I really don't like about it is the business aspect of medicine, all the paperwork and referrals, and from a business standpoint, me running my own practice and having to worry about making sure, we have enough vaccines and things aren't expired. And, if we don't have an office manager, because it's just a small office, me and 2 medical assistants, so if there is a problem, I'm the one that has to solve it or take care of it, So and I think most pediatricians would tell you the same thing. It's not just the business side, but if they're not in a private practice and they're working for a group, it would be the insurance aspects of it, needing to get authorizations for things. Sometimes it takes time, and you're trying to fight the system sometimes to get things done a little quicker than you might normally, but it shouldn't act as a barrier for care. If it does, or we think as a doctor that it does, then we have to be an advocate for the patient, and really, do what we can to make sure that they're getting the care that they need,
So, on the other end of the spectrum, what are the most rewarding aspects of being a pediatrician?
Being involved with the kids and teenagers and that, seeing them grow up. A lot of the patients I've been seeing for years, and it's just like a fun thing to do. I don't have any kids myself, so I enjoy that aspect. I try to spend a little bit of time personally if I can, if it's not real busy, I know some patients by sight because I've seen them for so long, So it's just the interaction with the kids and then with their families and that, So, yeah, if it wasn't for the kids, I don't know if I would be a doctor, so,
Yeah. So on that note, you kind of mentioned it, but what do you do in your free time?
Pretty much nowadays, not a whole lot, but I was active in sports, and scuba diving is my big thing, and photography. I love movies, and I watch a lot of movies at home, so I like electronics and surround sound and all that, but I'm pretty much of a homebody, and also being in private practice, I'm on call 24 hours a day, 365 days a year, but I was never, I got all my partying and everything done when I was in college and before. So I'm pretty much, like to go home at the end of the day and, relax and take it easy. And I don't really go out and do stuff too much. I don't associate with a lot of other doctors or go to like hospital functions or parties or that. I have one friend that she's a pediatrician as well, and we go out for each other's birthdays and that kind of thing. But otherwise, I, kind of do my own thing.
Okay. So do you have any regrets in regard to your medical decisions at all, or anything you would change?
You mean as far as seeing patients themselves, or just being a doctor?
Just being a doctor in general.
The way things are, and I think a lot of people that I know, a lot of us have said if we were to do it all over again, we would not be doctors, just because of the way medicine has changed over time. And certain restrictions are necessary, but that healthcare reform is important, and I'm one of the few doctors probably that does believe that universal healthcare is important, because there's so many people that don't have insurance. With the economy, a lot of people lost their jobs, and because of that, they lost their health insurance. And health insurance, I don't think, should have anything to do with whether you're working or not. Everyone should have it available. And it's just really hard for me to charge. Like, I had a patient earlier that, was on insurance, and they don't have any right now. And, it's hard for me to ask them for money, but I have to stay in business, So if I was to do it all over again, though, I would want to be something that they call a child life specialist, where you help kids, usually in hospital settings, but you could do it as an outpatient, that helps them to learn about their illnesses. Like if someone has to undergo chemotherapy, you try to help them to understand why they have to keep having blood work done or go to the hospital, and why are they sick. So it's somebody that interacts with kids that makes them feel better and try to alleviate their fear of a situation. Or like if kids have to have like a simple surgery, you pretend like they're the surgeon so that they kind of understand a little bit more. But I think if I was to do all over again, that's what I would do. Okay,
that's really interesting stuff.
Yeah.
Have liability issues ever affected you, or do they currently affect you?
Just paying for malpractice insurance, it can be very expensive. I've never been sued, and so, over time, your rates will start to go down. But, unfortunately, just like car insurance and medical insurance, rates are made based on the county that you live in and the state that you work in. So if there's more malpractice in a certain area, even though you haven't been sued, your rates are going to be higher. But pediatricians typically have lower malpractice insurance rates, and like surgeons have much higher, and like OBs, just because of the more likelihood for potential for problems,
Yeah.
So.
So what advice would you give to high school students interested in a medical profession, and even more specifically interested in becoming a pediatrician?
It's just good to have your eyes open and know what it is that you're getting into before you get to that point, because you really have to like what you do, no matter what profession you're in. If you don't really like it and you're just doing it for a job, you're not going to last in that, position for very long. So you really have to enjoy what you want to do and work to that goal to get to that point, It's good to have a backup plan, because getting into medical school, even though not as many people nowadays are applying, it's still very hard to get in, you know. So I know if I didn't get into medical school originally, way back then, I was thinking of microbiology. But like I said, when I got into pediatrics, there was this specialty called a child life specialist, and you don't have to be a doctor, at least back then you didn't, in order to do that. So look for alternatives that you could still maybe work in the medical field, but maybe not have as much financial burden on you going to school, like being a nurse practitioner. A lot of nurse practitioners work in hospitals primarily, but some doctors' offices might hire nurse practitioners. Like I said, just really know what you're getting into, because it's a lot of time and work, but if that's what you want to do, then that's what you should pursue.
Okay, thank you so much for helping us out, and yep, that was Dr. Krepak.
Okay.